Good morning, Franklin Township. Welcome to the September 22nd edition of the Franklin Reporter and Advocate News Hour, and also happy autumn. I know this is some folks' favorite season of the year. I enjoy autumn, but I'm a summer guy. Anyway, this morning we have a returning guest, Dr. Perry Halkitis he is the dean of the Rutgers University School of Public Health. And we're going to be talking about, actually just getting kind of an update on what's happening with vaccines for the coronavirus 19. I'm sorry, for the COVID-19, which of course sparks the coronavirus. A little early for me, folks, sorry. In case you don't remember Dr. Halkitis, again, as I said, he's the dean of the Rutgers School of Public Health. He is a public health psychologist, researcher, educator, and advocate. For decades, his research has specialized on infectious diseases to determine and target the biological, behavioral, psychosocial, and structural factors that predispose HIV, HPV, COVID-19, and other pathogens. So we are very happy to have him. He's been on numerous other national programs. I've seen him on cable TV news shows. So he's a recognized expert in the field. Before we get going, I just want to remind you folks to support your local independent news site with a subscription. It's only $37 a year. That's a little bit more than 10 cents a day. That is the best deal you're ever going to find on anything. So, PJ Parker, are we ready to go?
PJ Parker is ready to go. I just want to add that local independent media is indeed the Franklin Reporter and Advocate. FranklinReporter.com. Yes, it is early. I get it.
For sure.
10 cents a day, Franklin. You can't get it anywhere else.
That is true. All right.
I'm very excited to speak with Dr. Halkitis today. There's so much now on the news front as far as boosters, as far as the vaccinations that are about to be put out into the public for children 5 and I believe between 5 and 11. Other things being evaluated for either emergency use or full approval. There's just so much going on, and Dr. Halkitis is the man to give us the latest.
Well, thank you for that,
welcome
PJ.
you. Thank you.
And thank you, Bill. And, let me also do a shout out for you guys, for 2 shout outs also. I have an autumnal tie on for you all. So there it is.
Nice.
Right it's also probably the New York Mets colors too, but let's leave that. Let's leave that alone.
Even better.
Also, yeah, support your local news. I mean, local news is powerful. Local is the grassroots, perspective of your community is probably the best way to get information. So that's why I'm here with PJ and Bill to continue to help build this local knowledge rather than having things come to us from the top down. So PJ, Bill, I'm all yours. What do you want to know?
Thank you so much for those words. We really appreciate it. Well, okay? There's a lot of confusion. I'm confused, first of all, about the booster shot. Now, I was on. I participated, I think, in some sort of a live meeting, including a representative. It was the Franklin Township Advisory Board of Health, and there was the county representative on this meeting, and he mentioned that Somerset County is ready to go with boosters. We're ready to go. We have what we need. And this is a few weeks ago. Now, since then, I've heard all sorts of different things about what's going on with the boosters. So could you please set us straight?
Yeah, so sorry about that, guys. I mean, I think it's look, I mean, it's this bombarding of information every single day where we're all even people like me who are embedded every day in this pandemic, trying to make sense of it. So let me tell you what is recommended, and let me tell you then what I think, because those are not necessarily perfectly aligned. Here is what is recommended. As per the FDA, there's a recommendation right now that people who've had Pfizer, and then soon it's going to be Moderna, and soon it'll be Janssen too, who are immunocompromised and who are 65 and older should receive a booster as a way of increasing their immunity. That's the recommendation right now. So, but Biden thought everyone needed it, and Biden came out really early with that. I personally believe that over the course of the next few months, it's going to be suggested that all of us get boosted. Because quite frankly, the data do indicate over time a decrease in antibody response with the booster. Number two, I think the development of variants over time is going to make the need for a booster even more essential. And quite frankly, we have gone from a pandemic to an endemic. And what does that mean? It means instead of having a surge of disease like we had early on, now we have this like this disease that's just going to continue to exist in our mix, you know, for years to come. So if you're immunocompromised, and if you're over 65, which to me means 61, 62, 63, 64, quite frankly, I don't know what the difference is between 65 and 61. That's like just dumb. Get a booster. If you are concerned, get a booster, right? I personally have gotten a booster and I'm 58. And so I just think that it's going to become the norm. Don't let this like this sidetracking actually confuse you. I think President Biden was completely correct in what he said. The FDA tends to be real cautious.
When you say two things, can you define immunocompromised? Number one. Yeah, that would be the first question. And the second question, when you say a booster, are we talking about just an initial round of the booster right now, or I do believe the time frame is 6 to 8 months after the last dosage received?
Correct.
And do you foresee this as being an annual booster necessary?
The third, I'm going to go backwards. 3.
Yes.
Absolutely. Once you have a disease that becomes endemic, like the flu, it becomes an annual vaccination. And that's what happened. We didn't reach herd immunity in time. So now this disease continues to percolate, just like the flu continues to percolate. And every year, if we don't want to get really sick and the variants continue to develop, we're going to need an annual vaccination. I said this 6 months ago. It's going to be a reality for us for the foreseeable future. Hopefully somebody really smart can combine the flu and COVID vaccine into one shot so we don't have to go to the pharmacy twice. And I think that's just a reality moving forward. Because frankly, 30% of the population is never going to get vaccinated. And so the disease is going to continue to exist. Number 2, yes, PJ, when I say booster, I mean a little uptick, another shot, a third shot, or a second shot in the case of Janssen for people 6 to 8 months after their initial vaccination. That is completely right. So I went to the local pharmacy 6 months after this is before all of this happened. I was like, get in there, get to the CVS really quick, like now. And I got my booster and I love my red Band-Aid, which really was awesome. So I feel like a certain level of protection. Immunocompromised. Immunocompromised means people who have underlying conditions like cancers and other kinds of diseases, who are HIV not viremic, they're not like controlling their HIV. People, you know, who have diseases like MS and others whose immune systems are completely ravaged, right? Either through autoimmune diseases or like depressed immune systems. Those are the people who are being recommended. Of course, naturally, as we get older, I don't know why 65 is the magic number, because I think it happens all through our adulthood. At 50, the body really changes. At 60, the body really changes. But 65 is a demarcation of older adulthood. The immune system also gets weaker. And that's why the over 65 group is being recommended. So yes, every year, 6 to 8 months, and just a system that just can't fight disease is who's being recommended right now.
When you say the Janssen, do you mean the J&J single dose?
I mean the J&J, yeah, the Johnson & Johnson, Janssen, 1 dose. Moderna, the data is pretty clear that it's going to be, a booster is going to be available, and the Pfizer already is. So
I just read this morning, the Boston Globe had an article that the J&J vax is with the booster, considering that their dosage is just one single shot. Their booster has been proving near 100% efficacy. Is that your finding?
Yeah, it's not my findings, but it's my understanding. It's like, look, I mean, most vaccinations, if you were to go to a chart of vaccines that we use in childhood and throughout adulthood, you will see in most cases there's a dose and there's a dose 6 months later. This is not uncommon in vaccinology to have a situation like this. So yes, the booster is needed now. Yes, to your point, PJ, when we get to the point of the annual vaccination, might the formulations of the vaccines get better where we don't need a booster in between the years? Likely. Well, that will happen. But for now, because these are so new still, the booster does seem to give that extra punch. And let me just clarify for the listeners and the viewers why the booster matters. Because people are like, well, I'm not going to get really sick. Yeah, okay, right. Sure. You will, because if you are fully vaccinated with 2 doses of Moderna and Pfizer or your 1 dose of Janssen, you still can get infected because the variants like Delta have this ability to replicate really quickly. If your amount of antibodies in your body due to the vaccine are lower and lower and lower, it's going to be more difficult to control it. So imagine, if you will, an army of 100 Spartans ready to fight the Persians after you get the vaccine for the first time. And you've got all these Spartans ready to fight over the Persians. This is like, sort of like the antibodies in the vaccine and the virus. Over time, some of the Spartans die, right? So you have now only 20 Spartans left. I'm sorry, I'm a Greek. I have to use this metaphor. And now you have fewer Spartans to fight off the Persians. So you have fewer antibodies, you have lesser antibodies to fight off the vaccine. So you couple that with a variant that is much faster at replicating and making copies of itself, and you have these breakthrough infections. So I have known several people who have been fully vaccinated, who have gotten COVID again, who have had symptoms like horrible symptoms like feeling sick and stuff like that for a few days, losing taste. And they work through it. They didn't go to the hospital and die, which is fantastic, but they got sick. So if you want to avoid that, just like if you get a flu shot, you can still get sick a little bit, right? If you get a flu vaccine, you can still get the flu and get sick a little bit, but you're not going to get very, very, very sick. And what the booster does is avoid potentially any kind of sickness that you might experience if you get reinfected.
Would it have been prudent, and I didn't do this when I got vaccinated, but would it have been prudent for folks when they get the final, after the 2 weeks after the final vaccine shot, to have their antibodies checked and then maybe on a regular basis have that antibody checked to see how they're doing and when they may need a booster?
I'm sure people are doing these studies right now, Bill. I'm 100% sure people are doing these studies. Look, I did that single subject experiment last year before. I had COVID in March of 2019, and I did my antibodies every month until I was able to get the vaccine in January of 2021, and my numbers went down. Of course they did. Of course they did. And that immunity, quite frankly, that natural immunity is some way stronger than the vaccination immunity, right? So there's reason to believe that the immunity would go down over time, as it does with all vaccinations, right? It's like for those of us who had chicken pox as children, I just got my double dose of my 2 doses of my Shingrix because I'm in my 50s, right? My chicken pox vaccine. I had chicken pox as a kid, but this vaccination is going to prevent me from getting shingles. So yeah, it just happens. Bill, gosh, if we could test every American and see what happens to their antibodies, we'd have all the data. But I want to say one more thing to your viewers, which is look, I know this stuff is all intense and confusing, and but this is what happens when we have something new that we're learning about every single day. So every day is it's not like the scientists are dumb or the government is dumb. It's just that, there's new information every day. What are you supposed to do? There's new information every day. And so you have to adjust your mindset and try to deal with that.
Right. Okay.
We were just briefly touching on testing for antibodies. I am, as anyone who talks to me knows, I am a huge proponent of testing for COVID on a regular basis. I've been doing it for the last 18 months, at least every other week, if not every week, because that's definitively the only way that I'm going to know. And the testing seems to have dropped off as soon as vaccinations became the priority. But again, definitively, you don't know. And if you're vaccinated, that does not prove that you are going to be unable to transmit, and it does not necessarily protect you from getting this virus yourself. Right. The only way to know for sure is to get tested. Please, your thoughts on that?
Oh, 100%, 100% on that. You know, I wish we could test everybody regularly. So even those who are vaccinated. So I'll tell you my, and then I'll come back to your point. Yeah. So like in August, at the end of August, you know, my ear was hurting, my throat was scratchy. I was like, oh, youch. And I'm really careful. Like I don't do public things. So I tested because I wanted to make sure. And for those like 3 days, I didn't have the results yet because I did a saliva test. I waited. I think testing regularly, especially if you're feeling if you want to test regularly, that's great, and I support that. And if you have the capacity to do that, great. But if you're feeling not like yourself, even if you're vaccinated, get a test, right? If you've been potentially exposed, get a test, right? So we have a situation. I am waiting, Bill and PJ and Bill, for next week because I think the numbers are going to explode in the schools, right? I'm just waiting for that. And I will tell you this as somebody whose partner is a special ed teacher in a high school in New York City, that they already have 77 kids quarantined, right? So I don't know how it works in a school when you have like the kids vaccinated, but the teacher is not, or not everyone vaccinated. So I don't know. So testing consistently is a really good approach. I like it very much. I actually received a wedding invitation for December of this year for one of my favorite people in the world. And I'm going to this wedding, and the wedding invitation says you have to be vaccinated. And vaccinated, you have to be tested. And even if you're vaccinated, you might want to think about being tested 72 hours before the wedding. And I'm like, I'm going to this wedding because, and they're making the staff do the same thing. That's the way we stay safe.
Wow. There's somehow this mindset that if you're personally involved in a circle of friends or an event that's on a personal level, that somehow it's not going to affect you.
PJ, my favorite comparison to that is this, and this is, I've done HIV work for my whole life, right? People do not become infected with HIV from partners they don't know. People become infected from HIV from their romantic partners, because people take more risks with people that they trust. Right. So when I'm walking through Penn Station with this over my head, that's fine. Right. Right. Because I didn't have my mask today. I forgot my mask. But it's people, the minute it's like my mother, my grandmother, my brother, I feel safe. All inhibitions go down and risk increases. True for HIV, true for COVID-19.
Right. It's as if you don't trust these people, who are you? And it's just misplaced confidence.
I still haven't seen my brother. My brother has MS. I haven't seen my brother in a year and a half because of this very reason. I mean, I FaceTime him, but it's not the same thing, right? I said to him yesterday on the phone, I said, I hope I can see you for Thanksgiving. I really want to see you for Thanksgiving, but I don't know. And it's just because I don't want to have the possibility of getting to him and having been exposed and not knowing and potentially giving him COVID.
I just want to circle back to your comment about the schools. As of 2 days ago, in Franklin Township schools, we have 9 students and 8 staff who have reported positive COVID tests, and that's students in all but 3 of our schools: the high school, Claremont Elementary School, which is our newest school, and McAfee Road School. So it's making its presence known in Franklin Township schools as well. And there are also 8 staff members who have reported positive test results. And as you know, the governor, right, mandated that that teachers have to be vaccinated by October 18th, I believe it is.
And look, and I think the governor, if I was going to give the governor a grade compared to other governors, this governor is in the top 5 in the United States, right? Is he perfect? No. Right? But nobody's perfect around this disease. The problem with the teachers is this. What's magical about October 18th? Is COVID taking a break until October 18th? Like, what's going on? Right? It's like when I went to the gym in New York City a couple of weeks ago. The New York City gyms require now the PrEP proof of vaccination. And I walked in the week before, and I went to the counter, and I said to the person, "Would you like my vaccination card?" And they're like, "No, next week." I'm like, "Oh, that's right, because COVID's taking a vacation this week. No one's getting infected this week." And this is the same thing, Bill and PJ, right? It's like, what's happening between now and October 18th? You
Right.
said it. It's happening in Franklin. In Franklin, it's happening in every county in the state.
Mm-hmm.
It's happening all over the country. We see it in Florida. It's a disaster in schools.
Right. Well, we've been keeping a running count of township COVID cases overall since March of 2020, and right now I think the rate is 1 in every 100 township residents has been infected, and the mortality rate in Franklin Township is just about 3%. And so there are people who say, well, there's a 97% survival rate. Well, yeah, we'll tell that to the families and the friends of the 3% of the people who died.
That's absolutely
209
right.
people in Franklin.
209 Franklin Township residents have died. Talk to the 209 friends and relatives, of those people about the 97% survival rate.
Well, and the thing that it's absolutely. I think you have to. This is why I try as much as possible to personalize this information, because, like, if we think about the lives of those people that we've lost unnecessarily, or the people we put at risk, we might be able to take more care. Look, yesterday, on the 21st, we surpassed the deaths due to the 1918 flu in this country.
Right.
Mm-hmm.
It's 100 years since then. Come on, people. We shouldn't be here, right? But
and I do a lot of research, and I you have that newspapers.com website where we can go back to newspapers back in the 1800s, actually. And I was looking at a lot of the newspapers from around that time, and there was a significant number. We may have talked about this last time. There was a significant number of anti-maskers back then. They called them mask slackers, and there were fights, there were riots, there were people getting arrested and thrown in jail because they wouldn't wear a mask. So this is nothing new. I just want to also, again, you talked about you took the saliva test at one point. We talked about the other test. Can you talk about the efficacy rates of these different varieties of tests? Because now we have the rapid test. I understand there's an in-home test that's being developed. So can you talk about just how accurate these different tests are?
They are. Yeah. So look, ultimately the highest level of reliability is of the and the validity of the test, the accuracy, let's use that word, of the test comes from the swab, and the saliva test are probably the most accurate. The rapid test a little less accurate, but still pretty accurate. The technology has gotten better over the last year and a half. So I would have a high level of confidence in the results of those tests at this point, just because the technology has improved markedly since they first came out over a year ago. So high levels of accuracy.
Okay, yeah, and
probably every test that there is right now, from the rapid test to the nasal swab to the saliva test. And I do have some comments. First of all, the saliva test, when I did get that one, common sense told me, okay, don't eat anything. Don't drink anything like coffee. Don't chew gum if you happen to be a smoker. Does that not make sense? Okay. And when I got there, not one person was talking about that. There were people outside of this facility smoking and drinking coffee, and not one person administering these tests was indicating to anyone, not at least before 1 hour before you take this test. So therein lies the inefficiency of that particular testing, even though if administered properly and taken properly, I'm sure its level of efficacy is very high. As far as the nasal swabs, there's a variation in that administration as well. Some go all the way up in the nasal cavity when you tear and you feel like you're going to sneeze. And then I've had discussions with other administrators that, oh no, you only have to go a little bit inside the nostrils and it's very efficient. Oh no, you don't have to have both nostrils.
Right.
There's such a variety of ways to achieve this testing. What is the most effective testing for you?
Well, I think, look, PJ, I think that, what you speak to here is like any instrument, any tool is only as good as the person who's using the tool. So I might want to measure the length and width of my bedroom to buy a carpet, and if I don't measure it correctly, I'm going to get the wrong carpet size. It's the same idea here, exactly the same thing. So look, I think that, for me, I always rely on the saliva test that I do at home because I can control it myself, right? So I know 30 minutes before, no gum, no water, no nothing. And I just sit there quietly and then I spit for like 10 minutes because you need a lot of spit in it, right? But that's what I do just personally. I would just say that, for people who don't like invasiveness, this is the way to go. I think the you're completely right, PJ. The swab has to be really deep in, like this, like just putting it right here, right inside is not going to work. And so I would encourage people who are not okay with that to actually like rely on the saliva test and make you do it at home, because you can get it at home now. You can just order it in, and then you type it in, and then you send it out, and you don't have to even leave your home to be exposed to somebody.
Okay.
Can we talk
Bill,
about 5 to 11? As I think my time might be running out, but I want to talk about 5 to 11 because we haven't touched upon that, right, guys?
Yes, that was exactly
Sure.
my next question.
5 to 11. So Pfizer approved. Pfizer is going to be approved probably by October, mid-October for 5 to 11. Data is going to probably come out for the younger ones at the end of the year. I expect emergency authorization for Pfizer, and then the other medication, the other vaccines for the little ones, the 5 to 11s, probably by Thanksgiving-ish time, maybe end of October, early November. Okay, so that's good. It looks like that's helpful. I'm going to tell you my personal belief about what needs to happen. I think schools need to vaccinate these children. I think schools need to just like roll out the vaccinations and tell parents that these kids need to be vaccinated, because quite frankly, one, it's good for the public health. But mostly, I don't know, PJ and Bill, what this virus does to kids in 20 years from now. What I do know is there's a vaccine that can prevent kids from getting sick. So hopefully parents will buy on to this idea, will vaccinate their children, they will protect their children. And then those people who are so concerned about the masks and the breathing and the like psychology, which is, by the way, voodoo science, don't have to complain about those things anymore, because their kids are vaccinated and they don't necessarily have to wear masks as frequently. That's my feeling about 5 to 11.
Well, again, getting back to the kids, when we have a preponderance of elementary schools, especially in our district, and even up to the middle schools, up to age 11 is right now the most susceptible group in getting this, as well as being able to transmit it.
I think that parents are foolish to think that a new virus that we know nothing about doesn't have long-term effects on kids. I think that you protect your kid. I just think you protect your kid like you do with every other vaccine.
Scary.
Yeah.
It's very scary. But we have the awareness, and hopefully we have the wherewithal.
We need the emotional motivation is what we need. The drive to care for each other and care for, quite frankly, for our kids. Like, I think I would do anything in my power to protect children if I had them. Everything, right? And like wear a seatbelt, have them, eat well, have them, not eat garbage, have them wear masks in school. I would do everything in my power to protect my child. Why would I put my child in harm's way? That just seems like a bad parenting choice to me.
What do you suggest between now and the time that the vaccine for kids is actually available and approved? What is the most prudent course of action right now for parents, teachers, and kids?
Yeah, continue to wear masks, continue to distance. I would not encourage socialization outside the classroom right now. Why continue to expose kids? Wait till the vaccine is available. Let the kid go to school. They're getting socialization there. Let's not have extra play dates and extra exposures if not necessary. That's what I would recommend. And parents are very aware. The parents that I speak to are very aware of their little kids, and who they're vaccinated. They don't want to get infected and infect their kids. So go to school, wear your masks. Kids are going to be kids. They're going to take their masks off. There's going to be exposure. There's no way to control kids. But, the minute the vaccine becomes available, hopefully the schools will roll it out and make it easy on parents. Like I got my polio vaccination when I was in school, when I was in kindergarten, they're on the sugar cube. So that's what I hope happens.
All right. Well, Dr. Halkitis, I know you have to go, and we appreciate you taking the time to out of your busy schedule to talk to us and to educate us and Franklin residents about what's going on with vaccines. And hopefully you'll be back.
I will be glad to be back anytime you want.
I'm sure there'll be more developments happening in the months to come.
Yes. So, and can I just say one more thing to your viewers?
Absolutely.
Get your flu vaccine too, because the last thing you want is confusion. Right. So the flu vaccine is now. The flu vaccine takes 2 weeks to kick in. Go get it.
Right. You don't want to be confused between flu and COVID.
That's right.
Okay.
What about pneumonia?
I mean, pneumonia vaccines every few years. I mean, in people who are, I'm going to just say this, PJ, our age, should probably have the pneumonia vaccine. Yes, but it doesn't require an annual vaccination, the pneumonia vaccine. So talk to your healthcare provider about that. I do have it's the Pneumovax. I have it. I've gotten it. Shingles for people our age, all of those things. I mean, I think are really important. But the flu vaccine, I would say right now, given that flu season was near negligible last year, it's not going to be near negligible this year, just because people were socializing with each other again.
Mm-hmm.
So you don't want to be like in bed feeling fluish and confusing it with COVID and creating chaos in your life.
Right.
So go do it.
Whew.
All right. Well, thank you very much again.
Challenging time of our lives right now. It's
Yeah,
amazing.
it's very complicated. Thank you both for having me, and I'll talk to you again.
Thank you.
You bet.
Yes.
Thanks a lot.
Sooner than later. Thank you,
Bye.
Take care.
Halkitis.
Bye-bye.
Wow.
All right.
It
Well,
just,
that was interesting.
It just gets so scary. All right.
Yeah.
Folks, including myself, had some real reservations about the vaccine.
Right.
But there comes a point in time when it does have to be about others, as well as your own safety, but the effect that you can have on others and the protection of those around you. It's,
Yeah.
I'm sure I'm going to get some controversy about my next statement, but I've heard a lot about, well, my child, my decision, whether that child is masked or not. And although I do not have human children, my response, if I had a human child, would be, well, your decision not to mask your child affects my child. I think we all have to be ultra considerate of each other's rights and the global right as well. The global right that we all have to protect not only ourselves, but those around us. So it's less a right. Nobody is denying that parents have the right to their child's destinies. But I think somehow this does transcend the concept of right. In that context, it does not, however, transcend the concept of what's right.
True. So, I think that's going to wrap it up for this this edition of the Franklin Reporter and Advocate News Hour. Again, Franklin, I'm sorry. I'm looking at some comments here from, I suspect, one person who's got two different accounts, who's definitely an anti-vaxxer, who's been making comments the whole time. And
well, perhaps you should read a couple.
Oh, the jab doesn't work, and the inventor of the PCR test, who died 2 years before, or rather a year before COVID was around, or at least acknowledged, has called Fauci a fraud. I guess they're talking from the grave. I don't know, but I'm going to get in trouble again. I'm going to get another threat from a right winger, but I just don't have time for this nonsense. You know, we just don't have time for this crap. Get the damn shot. I almost said something else.
Yes, we could see this.
Just get the damn shot. Wear the damn mask. Look out for your damn neighbors. Social damn social consciousness. Get your head out of your navel.
It just boggles the mind that almost 700,000 people have died. And again, the argument has been made, well, how many of those are actually from other sources? Let's say that's half again as many. Let's say it's only 300,000. Let's say it's only 100,000. For those families who've lost a loved one, I don't think the argument is just. It exists. There is a deadly virus, and there are more of them. There's a very deadly virus right now called Nipah that's happening in India. I'm sorry, not Nipah. that now the world is watching. We are not going to be immune to any more variants. The variants will continue to mutate, and they will mutate on a host that's ready and willing and able to receive it. And primarily, folks, that's going to be the unvaccinated. You're going to be easier targets. And you being an easy target, whoever that you is then responsible for its transmissibility further. So again, we'll both stick our necks out on this level. And again, I'm a very holistic person. I had some serious reservations about vaccinations. But the other hat that I wear is that I'm a singer. And the projectile possibility, if God forbid I had COVID and I was in an environment where there were those sitting nearby and I had COVID, that projectile of those micro spitules can go 15 plus feet. I can't have that. I can't have people I work with not feel safe around me. I'm sorry if this is coming across as lecture-like. It's not. It's not. It's my own personal thought process that led me personally to get the vaccine. Kicking and screaming every step of the way because it hadn't been approved, etc.
1 in 100 Franklin residents has contracted COVID. Now, okay, so, and 3% of those who got it have died. Now, the 97% who survived, unfortunately, there's no follow-up as to, what percentage of those are long haulers, folks who have lingering side effects. I talked to a woman the other day whose son had it in March. I think she said he still has not regained his taste of his sense of taste, which for him is tragic because the guy's a former sommelier, and he needs to know in his profession what a particular wine or champagne tastes like. There are people who are going with long-term heart conditions because of COVID, and just regular body aches. I mean, there's all sorts of symptoms and effects of COVID that linger long after you're considered to be free of the virus itself, the active virus. So, saying 97% of the folks who got it survived isn't telling the whole story and is not being honest, intellectually honest. But when you're pushing a bogus theory like anti-vaxxers do, then you don't expect them to be intellectually honest.
Well,
I'm getting aggravated. It's not even noon yet, and I'm already getting aggravated. And that's not a good sign.
A certain amount of fear exists on either side of to vaccinate or to not vaccinate.
Well, 25% of the population is crazy. And I've said that for about 15 years, just based on my interaction with the people and what I do and what I've done since 1983. About 25, and it's always panned out that that's true. So when Dr. Halkitis said 30% of the population isn't going to get vaccinated, well, you take out that 25% that's nuts, and then you realize that there are 5% who may be legitimately concerned about, or maybe can't get the vaccine because of underlying health issues. I really have to curve myself here because I'm really.
I can see that.
I just don't understand people. It's a simple. You know what? If you don't want to get the vaccine, wear the mask. Oh, I can't wear the mask. It's a violation of my individual liberties. Are you kidding me? Are you absolutely kidding me? On top of which, kids, I know you got them. I got them when I was a kid. We had a variety of vaccines that we have to be able to go to public schools. Military people have at least 17 vaccines they have to take, required by military regulations. All of a sudden, this one vaccine is like, oh my God, we can't do this because it doesn't work and it's violating my principles and blah blah blah. shut the hell up and just get the damn shot. That's all I can say. That's all I'm going to say. And you know what? You want to send me nasty emails? You want to threaten me like that last idiot did for having the Antifa fella here? Be my guest. Come and get me. All right. I'm gonna sign off now. Franklin Township, thanks so much for tuning in. It's just a little incongruous, but if you want to support what you're seeing,
Oh yeah,
and you want to support people who aren't afraid to take a stand and to say what they believe in, what's right, then you need to support the Franklin Reporter. We give you a breadth of coverage like no other news organization that purports to cover Franklin Township. And you need to support us by subscriptions, which you can do on the Franklin Reporter website, www.franklinreporter.com. $37 a year, less than 10 cents a day, best deal in town. You also need to support us through advertising, which you can inquire about through the email adsads@franklinreporter.com. Independent local journalism is important to towns because studies have shown that when local journalism goes away, taxes rise. If there's no other reason for you to support us, and if you want to take it from that point of view, from your wallet point of view, no other reason to support us is that us keeping a spotlight on what's going on in municipal building and elsewhere keeps our taxes down, or tends to keep our taxes down. I don't want to cast any aspersions on the current government. PJ, you have anything to say?
wow. That's a tough act to follow, Bill Bowman. What I do want to say about the Franklin Reporter and Advocate and advertisers is that, yes, of course, we welcome your support on that level. But the fact that the Franklin Reporter and Advocate brings you the news around our town, the news that people care about, especially with what's going on with COVID, you know that our reporting, in conjunction with the stellar work of our Dr. Mayor Phil Kramer, in keeping our town informed as to the latest developments, as well as those school activities, which we are so prominently involved in. The kids are our future, and we're there. You've seen us there. We take pictures, we take videos. The kids know us. They come to us if they have issues. Kids want to see their pictures in our monthly digest newspaper. They want to see their friends' pictures. You as an advertiser benefit from people wanting the news and wanting to see their fellow Franklinites. So that's a plus. That's a plus for you, that you get to ride on the coattails of the interest in Franklin Township news. The other thing that I have to inject about the COVID virus, touched me very personally. Although he's okay now, my younger brother was near death. He was on oxygen consistently for almost 3 weeks. He's home now. His oxygen levels are stable, but he still has trouble speaking without coughing. He still has lung issues. He has cardiology issues. This is not an illness to take lightly or politically. He was not vaccinated. He was healthy when this happened to him. If he had been less than healthy, he would have been gone that first week. Please, Franklin, if you're hesitant, please think. Do your research. Find the vaccine that you are most comfortable with. Do it for yourself. Do it for your neighbors. Do it for your children. Please.
Well said. And on that note, Franklin Township, we're going to bid you adieu. Until the next time. As usual, Franklin Township, until we see you again, please stay safe. PJ, say that thing that you always say.
And we will be back.